Good afternoon, good evening, everybody. I welcome all of you to this webinar uh, in which we will be looking at what are the recent advances in the treatment of autism, cerebral palsy, and certain other incurable neurological disorders, and what are the benefits from the latest integrative therapies.
أهلا وسهلا بكم. مرحبا بالجميع. التطورات الحديثة في علاج التوحد، الشلل الدماغي واضطرابات العصبية أخرى مستعصية فوائد أحدث العلاجات المتكاملة.
And I'd like to welcome everybody.
وأحب أن أرحب بكم جميعا.
I am Dr. Alok Sharma. I'm director of the Neurogen Brain and Spine Institute, and I'm also professor and head of Department of Neurosurgery at the LTMT Hospital and Medical College in Mumbai.
أنا الدكتور ألوك شارما، مدير مستشفى النيروجين للدماغ والعمود الفقري والمعهد في النافي مومباي.
I'd like to state that this presentation is for information purpose only, and it is not a substitute for a medical consultation, for which you should consult your local doctors. And I'd also like to acknowledge Stem Cell Africa, Ms. Angeline, and parents in North Africa who invited us to make this presentation.
المقصد هنا لنقاش المعلومات الخاصة، وليس المقصد لمجرى الطبي للمحادثة، للنقاش فقط مع الأمراض.
So why are we all here? We are here today at this webinar because all of us here have special needs children who are suffering from various neurological disorders, and we want to find a solution to help these children.
لماذا نحن هنا اليوم؟ نحن نريد أن نساعد الأطفال الذين يعانون من الأمراض التوحد وغيرها من الأمراض العصبية.
So, right presently, if our child has autism or cerebral palsy, we are told that there is no cure, we are told there is no surgery possible, that there are no medicines possible, and we only have to do rehabilitation. This is what we are told presently.
حاليا نموذج العلاج الحالي الذي يجرى عندنا لا علاجا ولا تدخل عملية جراحية ولا أي شيء من الأدوية، إعادة التأهيل فقط.
But what we are here to tell you is that there are parts of the brain which are in circles which are damaged, and it is possible to correct this brain damage.
الشيء الذي نريد أن يقال هنا، الصور اللي موجودة أمامك هي التي في الدائرة، هي المناطق التالفة للمخ.
So today we are going to talk about a combination of three treatments. We are going to talk about cell therapy, we are going to talk about rehabilitation, and we are going to talk about something called integrative therapies. So three treatments: cell therapy, rehabilitation, and integrative therapies.
اليوم سنتحدث عن 3 أشياء في العلاج.
So this is just to show you that in this slide which is blue, which is damaged, after the combination of our treatments, you can see it has all become green and good. So you can see the difference between this and this. And our combination treatment of stem cell therapy, rehabilitation, and integrative therapies makes this difference.
المعالجة بالثلاث الطرق الحديثة ممكن ترى أمامك الأشعة الموجودة، ترى الفرق بين الأشياء العلامة الزرقاء هنا والأشعة الثانية اللي تحتها، ترى الفرق بين التحسن.
So I ask you, you see this X-ray, this is of a broken bone, a leg bone which is fractured. And my thing is, will we give exercise rehabilitation on a broken bone? No, we will not do it on a broken bone. We will repair the bone. We'll repair the fracture with plates and screws and then give rehabilitation. So we never give rehabilitation on a broken bone. We give rehabilitation on a bone which is fixed.
لا نعطي التأهيل بالعظام المكسور. هنا عندك بالأشعة الذي أمامك سوف لا نعطي التأهيل بالعظام المكسور، سوف نقوم بمعالجة العظام المكسور وبعد ذلك نعطي التأهيل، العلاج الطبيعي.
But when it comes to brain, this is a brain scan which shows brain damage in autism and cerebral palsy. And what happens is we are now presently giving rehabilitation on damaged brain. What we should be doing is we should repair the brain. You can see here the brain is repaired and give rehabilitation on repaired brain, because the results of giving exercise and rehabilitation on repaired brain will be better than that on damaged brain.
عندك أمامك الأشعة، عندك المخ التالف اللي هو محطوط بالعلامة الزرقاء المدور عليها، والأشعة الثانية الذي عندها العلامة الدائرة إنها صارت التحسن في المخ التالف. سوف نعطي التأهيل.
There was an older thinking that once there is damage to the central nervous system, which is the brain and spinal cord, it never regenerates, it doesn't repair. This was an old thinking, that damage to the central nervous system cannot regenerate.
التفكير القديم سابقا أن الجهاز العصبي المركزي غير قادر على أن يتجدد.
But the new thinking is that some amount of repair and regeneration is possible using cellular replacement and repair.
التفكير الحديث، التفكير الجديد الآن أنه يمكن إعادة تجديد المخ، الخلايا المخ ثانية مرة أخرى.
So cellular therapy is, I call it, an idea whose time has come.
العلاج بالخلايا الآن لقد حان الوقت للتفكير فيها.
And cell therapy helps us to go from a state of hopelessness to one of hope.
العلاج بالخلايا الآن يعطيك من اليأس إلى الأمل، التقدم من اليأس إلى الأمل.
So, just like the stem of a plant, from the stem of a plant, leaves and fruits arise. So, like from the stem of a plant, you have branches, leaves, and fruits. There are some cells in the body from which any other cell of the body can be made. These cells are called stem cells.
نفس الشيء زي ما نشوف بالزرعة، الحبة الزرعة اللي نضعها في الأرض وتثمر لنا وتغسل لنا أغصان كثيرة، نفس الشيء هي ما هي الخلايا الجذعية التي تعطينا الستيم سيلز، هذه الخلايا الجذعية التي تساعد على تأهيل الخلايات التالفة.
Stem cells are of two types. We can take stem cells from our own body, from the patient's body, and put it back into the part which is damaged, which is called autologous, or you can take stem cells from somebody else, from another, and put it into the patient. This is called allogenic. So there are two types of stem cells. When you take from the same body, put it back in the same body, or when you take from somebody else and put it back. There are two different types.
هناك نوعان من الخلايا الجذعية، نوعا أن يأخذ الخلايا الجذعية من الشخص نفسه، المريض نفسه، وهناك خلايا جذعية يؤخذ من شخص آخر ليساعد على تأهيل الخلايا التالفة.
So stem cells, what they do is they repair, they replace, and they regenerate damaged tissue.
أصلا الخلايا الجذعية هي الخلايا التي لديها القدرة على الإصلاح وتحل المحل والتجديد.
So let us try to understand how do stem cells work.
يلا بنا نعرف كيف هؤلاء يعملون.
So the first quality of stem cells is that they multiply. So if you have one stem cell, they multiply into many thousands of stem cells.
أول شيء أنها تتضاعف. إذا عندك خلايا جذعية واحدة تتضاعف عندك بالملايين.
When stem cells multiply, they also differentiate. So a stem cell can become into different types of stem cells. So if you have the same stem cell can become into a brain, into heart, lung, muscle, any other tissue of the body. So the quality of stem cells is it can become into any other cell. It can convert into other cell.
الخلايا الجذعية لها القدرة على تحويل أنواع الخلايا الأخرى. عندك عدة خلايات ممكن تحول لها، زي العضل ممكن تتحول إلى أشياء أخرى.
They also release certain positive chemicals in the body which help in repairing damage.
إنها تؤثر تأثيرا إيجابيا لإطلاق مواد كيماوية في الجسم.
And they also improve the blood supply to the damaged tissue.
أيضا تقوم بتحسين تدفق الدم.
There are different types of stem cells and you can get stem cells from the embryo, which is from aborted tissue, like from when the from tissue which is from abortion, and we do not use those type of stem cells.
ممكن تأخذ الخلايا الجذعية من الإجهاض، بس نحن لا نستخدم هذه الخلايا الجذعية.
You also get stem cells from the umbilical cord. Umbilical cord is the cord that connects the mother and baby at birth, and if it has been saved at birth, you can use stem cells from that.
ممكن نستخدم الخلايا الجذعية عند ولادة الطفل، إذا هي صالحة للاستخدام نستخدمها.
Then you also get stem cells in our own body, inside our bone. In the bone there is a liquid, and inside of that there are stem cells. These are called adult stem cells, and we use these stem cells.
أيضا ممكن استخدام الخلايا الجذعية الموجودة داخل العظام. يوجد داخل العظام سائلا ممكن نستخدمه كخلايا جذعية.
So we use adult stem cells because they are safe, they never become tumors, they don't get rejected, it is easy to get them, and there are no ethical issues about its use.
نحن هنا نستخدم الخلايا الجذعية البالغة اللي هي آمنة وغير قابلة للورم ولا يرفض عليها ويمكن الحصول عليها بسهولة ولا قضايا أخلاقية عليها.
There are different ways of injecting it. One way is to, with a very thin needle, to inject it into the fluid in the lower back, and this is our preferred method.
طريقة الإدارة الخلايا الجذعية ممكن تؤخذ عن طريق ضع الإبرة في الورق ويأخذ منها سحب منها الخلايا الجذعية.
You can also give it through an injection into the blood called intravenous injection, like how we give any other injection, or you could put it directly into the muscle. So there are different ways of doing it apart from that, apart from intrathecal. Just like a regular injection, it can also be given.
ممكن أخذ الخلايا الجذعية عن طريق الإبرة العادية، ممكن يضعها في الدم وممكن يضعها في أي مكان مثل الإبرة العادية في العضل ممكن.
So the reason why we inject into the lower back fluid is because it is very safe and the cells go directly to the damaged brain. It's minimally invasive, it's safe, it has no side effects, and the cells go directly to the damaged brain.
الأمر الذي نقوم به أنه نضعه في أسفل العمود الفقري لأنه طفيف وإنه لا له أعراض جانبية، توجد خلايا أنسجة المخ المصابة لا يوجد أي أعراض جانبية لها، لهذا نختار أن نضعه في أسفل العمود الفقري.
So basically, stem cell therapy involves the use of healthy cells to replace damaged cells.
الخلايا الجذعية هي أصلا هي الخلايا السليمة، هي عن طريقها تقوم علاج الخلايا التالفة.
So in this slide, you can see the blue area is the damaged area. If we put stem cells, the damage goes away.
نحط الخلايا السليمة فوق الخلايا ثم تحل محل الخلايا التالفة.
So let us look at what is the scientific base for cell therapy.
ما هي القاعدة العلمية للعلاج بالخلايا؟
So the most prestigious prize in the medical field is something called the Nobel Prize. And three times in 1990, in 2007 and 2012, the Nobel Prize went to stem cell research.
إنه في الشهادة نوبل إنه في 3 سنين
What is the scientific basis of the work that we do at Neurogen?
ما هو الأساس العلمي للعمل الذي نقوم به في نيروجين؟
So all the work that we have done, it is published in more than 100 scientific international and national journals. So everything that I'm going to talk to you about now is published in scientific journals, more than 100.
أكثر من 100 مقالة هي مطبوعة في المجالات الوطنية والدولية نشرت فيها، ممكن أن تتابعها.
And in many medical textbook, like this is a medical textbook on recent advances in autism, they have a chapter stem cell therapy in autism, and they invited us to write this chapter.
وعندك في الكتب الطبية الذي دعونا أن نقوم بكتابة عن التوحد.
And again, there is this book on cerebral palsy. It's a European book, and again they have a chapter, stem cell therapy for cerebral palsy, and again they invited us to write this chapter.
وأيضا في الجهاز العصبي أيضا هذا كتاب في أوروبا الذي طبع، هم دعونا أن نكتب عنها.
And in other books, like this book on physical disability, the stem cell chapter is written by us. And in this book on muscular dystrophy, the chapter on stem cell therapy is written by us.
أيضا عندنا الكتب المطبوعة هذه عن طريقنا الذي نقوم بطباعتها، هم دعونا أن نطبعها.
The reason why I'm showing you all this is to tell you that stem cell therapy is already in medical textbooks, and there are chapters on this, and most of the time the people who write this book ask us to write the chapter.
الغرض من أن الخلايا الجذعية إنها مذكورة في الطب حاليا في اليوم هذا، وهم دعونا أن نكتب عنها في كتبهم.
So the government of India is at the very highest level is supportive of stem cells.
لأن حكومة الهند على أعلى مستوى داعمة للخلايا الجذعية.
Our Prime Minister Sri Narendra Modi, he himself is a big believer in stem cells. When he went to Japan, he visited the laboratory of the Nobel Prize winner Professor Yamanaka. And in India also, whenever he gets chance, he goes to visit stem cell laboratory.
رئيسنا هنا في الهند هو داعم للخلايا الجذعية.
And this is myself with the Prime Minister Sri Narendra Modi. I'm giving him a copy of a book which I have written.
هذا الرئيس ناريندر مودي الذي أعطيه الكتاب، وهذا أنا.
And the Prime Minister has written an introduction for a book which I have written, I have authored. Sri Narendra Modi has written an introduction for my book.
والأستاذ ناريندر مودي هو كتب مقدمة بالنسبة للكتاب الذي نشرته.
So now let us look and see how this treatment is done.
خلينا نشوف كيف يتم العلاج.
So there are 3 steps in this treatment. In the first step, we put a needle into the bone, which is just above the hip bone, and we take out the liquid from the bone. This is called bone marrow aspiration.
كيف يتم علاج الخلايا؟ يتم علاج الخلايا عن طريق 3 مراحل، 3 خطوات. نقوم بإضاعة الإبرة في الورق ونسحب السائل من جسم المريض.
Then this bone marrow which we take out, we take it to a laboratory and we separate the stem cells from this bone marrow.
نأخذ السائل إلى المختبر الذي لدينا ونقوم بتفريق الخلايا الجذعية منها.
Once the stem cells are ready, with a very thin needle, we inject it into the lower back fluid, and the lower back fluid takes it to the brain.
بعد تجهيز الخلايا الجذعية نأخذها ونضعها أسفل العمود الفقري للمريض، وهي مباشرة تمر إلى المخ.
So in this whole treatment, the patient gets only 2 needle prick. With 1 needle, we take out bone marrow, and with the other needle, we put back stem cells. So there are only 2 needle pricks.
يعني العملية الخطوات كلها ما يأخذ منك إلا إبرتين، إبرة واحدة في وقت سحب الخلايا الجذعية، والإبرة الثانية وقت إدخال الخلايا الجذعية.
So we will now see a video of how this treatment is done.
الآن سوف نشاهد الفيديو كيف يتم هذه العملية.
This is the bone marrow aspiration. Here we separate the stem cells, and here showing how we inject the stem cells into the lower back. We will see the video once again.
سوف نشاهد معنا الفيديو.
So as you saw in the video, there were only 2 needle pricks. So with one needle, we took out bone marrow.
سحب النخاع العظامي.
And with one needle, we injected the stem cells.
وزرع الخلايا بالإبرة الثانية الأخرى.
Now we will look at autism. The thing about autism is that in 2004, 1 out of 166 children had autism. Whereas in 2018, it became 1 in 59. So there has been a 3 times increase in the incidence of autism the last 15 years.
الآن نشاهد معنا التوحد، كيف تم التوحد هنا عند الأطفال، وصار بالعلاج الخلايا الجذعية النقص في المرضى.
This means that there are 70 million people in the world who are on the autism spectrum, and that is 1% of the world's population. Yeah, there's 70 million people on the spectrum. That's 1% of the world's population. So, autism is a neurodevelopmental disorder, and it can be mild, moderate, or severe. And boys have it 4 times more than girls.
التوحد هو أكثر إصابة في الأولاد من الإناث.
The 3 problems of autism, there is poor social interaction, there is impaired communication, and there is repetitive behavior.
المشكلة الرئيسية في التوحد هي ثالوث الأعراض.
What is new today? Why are we having this webinar? What is new is that we have a better understanding of autism today. And we have a new treatment for autism, which is called stem cell therapy.
ما هو الجديد هنا؟ الجديد هو فهم التوحد والعلاج بالخلايا الجذعية للتوحد.
A question parents keep asking themselves is, why did my child develop autism?
أكثر الأبوين لهم مشكلة إن لماذا صار نتيجة على التوحد لولدي لطفلي.
So what are the causes of autism? They can be problems that occur prenatally, that means during the pregnancy process. They can occur because of problems in the intestine of the children. They can occur because of exposure to chemicals in the environment, and it could be because of mobile phone radiation.
العوامل البيئية المسببة لاضطراب الطيف التوحد ممكن من الأمعاء، ممكن لاستعمال الآلات الإلكترونية زي الموبايل الذي يصير بها الطفل.
So prenatally, we have found that the health of the mother is very important. So, if the mother has any infection during pregnancy, or if she has any diabetes, or even if she has any emotional problems like depression, um, then there is a greater chance that she may have a child with autism. So, the health of the mother, physical health and emotional health, is very important because any problem in the health can cause, can the child can get autism.
الأسباب ما قبل الولادة إذا المرأة الحامل الذي ممكن تمر بها الطفل إذا كان عندها سكري أو عندها أي أمراض في الولادة أو عندها بتدخن يحصل التوحد للطفل.
Then older fathers, so a father at the age of 45 is 3.5 times more likely to have a child with autism than a father at 24. So old age of the father is one cause also.
أيضا من أسباب التوحد هو الأب إذا شيخوخة الأب، يعني إذا كان عمره 24 إذا كان عمره 45 ممكن إذا يصير طفله بالتوحد.
Children who have problems in the intestine, in their gut, uh, uh, that also has a relationship to autism. So 9 out of 10 children with autism have GI problems. So there is a connection between the gut, intestines, and the brain.
أيضا العامل الآخر الذي يصير به الطفل بالتوحد هو عند تكوين الغير الطبيعي للبكتيريا في الأمعاء الطفل.
And when the mother is pregnant, when the baby is in the womb, that time if the mother talks a lot on mobile phones, then the mobile phone radiation can damage the developing child's brain.
أيضا من الأعراض التي تحصل للطفل بالتوحد التعرض للمجالات الكهرومغناطيسية لاستخدام الهواتف المحملة.
Also, there are certain chemicals like lead, then mercury and aluminium. So these things can cause brain damage.
أيضا تسمم الألمنيوم يحدث له بسببه التوحد.
There is a controversy as to whether vaccines can cause autism, but this is a controversial subject, and there are many articles, there are more than 25 articles that show that there is no connection between autism and vaccines. But some people believe that there may be a connection.
يرى البعض أنه هناك لقاحات للتوحد، إنه هناك عدة مقالات نشرت ولكن لا يوجد لقاحات للتوحد، ليس لها علاقة.
Now we have done at Neurogen, we have done some original research on the brain of children with autism, and we find that all the children with autism have a brain damage like you see in this blue color. So they all have a part of the brain which is not working properly.
يظهر في المناطق المضطربة في التوحد الذي عندك في الشاشة باللون الأزرق.
And this original research of ours is published in an important scientific journal. So, the treatment of autism, there are many treatments. All these listed treatments, all these, they work together. We will look at all these different treatments. So,
أن علاج التوحد لها عدة علاجات سوف ندخل عليها.
So there is a treatment called ABA or Applied Behavioral Analysis, and this is a psychological treatment that helps the children.
علاج تحليل السلوك التطبيقي للتوحد.
Then we have occupational therapy, which also helps children with autism.
علاج بالممارسة ممكن يساعد الأطفال الذين مصابين بالتوحد.
Then we have a treatment called sensory integration.
عندنا علاج اسمه علاج التكامل الحسي.
And this is a sensory integration room where therapy is done.
وهذه غرفة الذي يتم به العلاج بالحس والتأهيل.
Then speech therapy is very important in children with autism.
وعلاج النطق هو مهم جدا هنا للأطفال المصابين بالتوحد.
Physiotherapy also has an important role. Then there is a new treatment called aquatic therapy, which is therapy in water. And this also has a lot of beneficial effect in autism.
هناك علاج يسمى العلاج المائي.
Then there are various art-based therapies such as music therapy and drama therapy.
أيضا يوجد هناك تأهيل بالموسيقى للعلاج التوحد.
Then we have a new treatment called hyperbaric oxygen therapy, in which the child is put inside a chamber like this and high concentration, high pressure oxygen is given.
أيضا يوجد العلاج بالأكسجين العالي الضغط.
And there is a therapy called neurofeedback, where the brain of the child and the computer are connected. So there is a feedback from the brain to the computer.
أيضا هناك علاج بالارتجاع العصبي يدخل فيه بالكمبيوتر مع مخ الطفل.
So diet has a very important role to play, and there are certain foods which should not be given, and there are some foods which should be given. So we prefer to give gluten-free, casein-free diet, and things like camel milk and curcumin, they have been shown to be beneficial.
عندنا نظام غذائي أيضا الذي يمكن يتبعه المريض، ونظام غذائي الذي لا يتبعه الذي يمنع عنه أن يأخذه.
And sugars and food which has a high amount of sugar and which are difficult to digest starches. So these kind of foods should not be given.
الأكلات التي فيها السكري والأشياء الغير صحية يمنع أن يأخذها الطفل الذي مصاب بالتوحد.
A ketogenic diet is a very important diet which is high in fat, has enough protein but low carbohydrate.
الكيتون النظام الغذائي.
But despite this, are we doing enough?
هل نفعل ما يكفي؟
So here is the role of stem cell therapy, and although we have treated more than 2,500 patients, this is data from 700, in which 33% of the patients had significant improvement. That means they became normal. 29% had a moderate improvement. That means they had a good improvement, but they still had a few symptoms left. 25% had a mild improvement and 10% did not improve. So overall, about 90% of the patients improved.
عندك بيانات 700 مريض المصاب بالتوحد، وهنا عندك البيانات الكاملة. تقريبا ما يعادل 89% من الأطفال الذي نجحوا تطوروا بهذا واتشافوا بمرض التوحد.
So this is the objective result. So you can see on top is the brain scans of the same child. You can see the blue is the damaged part. This is the above. And the same child, 6 months after stem cell, you can see that the blue has totally gone away. This blue is much reduced. This blue is reduced. So this is an objective improvement that the brain damage in children with autism can be reduced.
نرى في الشاشة عندنا السكان هذا اللي موجود. اللون الأزرق هو الخلايا السالفة، ونفس الطفل عندنا إنه تم علاجه بالخلايا الجذعية بعد 6 أشهر. تم مسح الخلايا التالفة هنا وقام بالتحسن.
So here again you can see that there is this brain damage before, and you can see after stem cell the brain damage is gone.
هنا أيضا نرى عندنا الخلايا التالفة في المخ، وبعد 6 أشهر اختفى تماما الخلايا التالفة في المخ.
Again here just to show the damage before and after stem cell, it is the damage is gone.
هنا أيضا عندنا مرة أخرى نشاهد العلامات الزرقاء، هذه الخلايا التالفة في المخ ومصادها.
Here to show you, when we do scans year after year, the improvement continues. So you can see this damage 2012 and 13 it became less, and 14 it became still less. So the improvement is a progressive improvement.
التحسن هنا تشوفوا إنه يتطور. عندنا في سنة 2012 2013 2014 تم تخفيف الخلايا التالفة.
And our work is published, the world's first international scientific paper on the role of stem cell therapy in autism is published by us.
التوحد الورقة المغيرة هنا الدولية الأولى في العالم حول العالم بالخلايا الجذعية.
So we published the world's first paper on stem cell and autism. The second paper came from China, the third from Italy, and the fourth and fifth paper came from America. So Asian countries, that is India and China, we are the leaders in this, and we have published papers ahead of Europe and America.
نحن أول ما يقوم به في العالم نشر مقالة في الخلايا الجذعية، بعدها الصين وإيطاليا USA.
Apart from the world's first paper, we have a total of 16 scientific papers of autism.
لقد تم نشر 16 مطبوعة علمية في التوحد.
Then can we combine stem cell with other treatments? And the answer is there is no contraindication. You can combine stem cells with any other treatment that you're already taking.
هل يمكن جمع بين العلاج بالخلايا الجذعية قبل وبعد مع العلاجات الأخرى؟
So we have actually, small videos from children from each of the continents, from America, Europe, Africa, Asia, and Australia. But you've already seen the one from America, so we won't repeat that. We'll just show a small clip of this is a story of a family that had triplets, 3 boys, 3 triplets, all 3 of which had autism, which was very severe. And this video shows how they improved after stem cells.
عندنا فيديو قصير نشاهده من أمريكا، إن عائلة لها 3 أطفال كلهم مصابين بالتوحد، وكيف بعد الخلايا الجذعية صار تحسنهم.
And when I brought it up, they were like, oh, no, don't worry. It's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. And no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, it takes a few minutes, and he's asleep.
See my son's cycle. We tried to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah,
Okay. So I'm going to give you
money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that was a video that showed 3 triplets and how all 3 of them improved significantly after stem cell therapy. So that was about autism. Now we will very briefly cover some of the other topics. So cerebral palsy, there is much more severe damage to the brain. As you can see here, in cerebral palsy, the brain is more damaged than that of autism.
عندنا في الشلل الدماغي من المناطق المضطررة في الدماغ.
And in autism, the problem is more with the mind and thinking and speech. In cerebral palsy, the problem is more with the body. There is tightness and there is weakness of the hands and legs.
عندنا في مرض التوحد في النطق، لكن في الشلل الدماغي في المشكلة في الجسم.
So these are the results of our results of stem cell therapy in cerebral palsy. You can see we have a 90% success rate. Here about 20% of the children become normal, 41 have moderate, 30 have mild, and 9% don't improve. Go ahead. Doctor. So this is a scan that shows the damage before. You can see the blue is the damage before, and you can see after stem cells the damage is reduced significantly.
عندك في الشاشة هنا اللون الأزرق هو المناطق التالفة، وبعدها بالصورة الثانية التحسن عن خلال الخلايا الجذعية.
Here again on the left side you can see the brain before stem cell, you can see the blue damage, and after stem cell you can see that the damage is gone.
هنا عندنا أيضا في اليسار الأشعة المناطق الزرقاء هي المناطق التالفة في المخ، وعندنا في اليمين كيف تم التحسن بعد أخذ الخلايا الجذعية.
And our work is published in scientific journals. In this is our results are published in this journal Stem Cell International, which shows the benefits of stem cells in cerebral palsy.
وهذه هي الشهادة العالمية الذي وكيف تم نجاح أخذ الخلايا الجذعية التي تعمل في المريض.
And we have a total of 15 scientific papers of stem cells in cerebral palsy.
تم نشر 15 مقالا علميا حول الشلل الدماغي.
Now let us see this video. This is a video of a child from Kenya who was very severe cerebral palsy. He was totally wheelchair bound. He could not use his hands and legs. And we'll see the results in this video after stem cells.
الآن نقوم بمشاهدة فيديو للطفل من كينيا الذي له الشلل الدماغي، لا يعمل يداها ولا رجليها، وبعد أخذ الخلايا الجذعية كيف صار حاله. يلا بنا.
So this child, you can see before he was not able to use his hands and legs. Now you can see how he is using his hands and legs.
لقد شاهدت الطفل الذي هو المصاب بالشلل الدماغي لا يستطيع أن يستعمل يداه ورجلاه، وشوف الآن الفرق بعد أخذ الخلايا الجذعية.
So now you can see how a totally wheelchair bound child, he is now able to walk independently.
الآن ممكن تشاهد الطفل ليس جالسا على الكرسي، بل إنه يستطيع أن المشي بنفسه بعد أخذ الخلايا الجذعية.
Then there is a condition called muscular dystrophy in which the muscles start getting weaker. And as you can see in one type called Duchenne muscular dystrophy, at 5 years, this black gray is what normal muscle looks. And if you see over the years, it is slowly becoming white. And by 16 years, it is totally white, replaced by fat. So you can see between normal muscle, how the muscle disappears in 10 years.
عندك حتى العضلات ممكن تشوف خلال الخمس سنوات كيف متعصبة وبعد 6 سنوات وكيف صار الفرق عندك في الشاشة.
So this is the difference. At 5 years, this is how the muscle is, and at 21 years, you can see it's almost completely gone. And these are our results. So 4.5% patients have a significant improvement, 35 have moderate improvement, 20 have mild improvement, 14% of the patients remain the same. They do not deteriorate.
عندك حالات مختلفة للأمراض الأطفال الذين يعانون.
And this is a comparative study we did. So you can see that the green graph, the children who we treated muscular dystrophy, they stabilized like this, and the patients who did not get stem cells, they deteriorated like this. So this is a comparison between patients who did not take stem cells, who deteriorated, and the ones who took stem cells, who stabilized.
هنا عندنا الفرق. عندك الخط الأخضر الأمراض الذي أخذونا الخلايا الجذعية، وعندك الخط الأزرق الأمراض الذين لم يستخدمون الخلايا الجذعية، علاج بالخلايا الجذعية. هنا عندك الفرق.
And this is an MRI before stem cell. You can see it's all white, fatty. And after stem cells, you can see that it is dark. That means muscle has started forming again. So after stem cells, muscle is coming inside.
عندك في الشاشة قبل زرع الخلايا الجذعية، وعندك بعد أخذ الخلايا الجذعية إن هناك عضل بدأ يولد عن طريق الخلايا الجذعية.
And again, you can see before the stem cells, you can see that the muscle contraction is very weak, and after the stem cell, the muscle contraction is much stronger.
عندك العضلات في الشاشة في الصورة الأولى إنها ضعيفة، وبعد أخذ الخلايا الجذعية إنها صارت قوية.
And we have all these 18 scientific papers published on stem cells in muscular dystrophy.
ونشرنا مقالات عديدة في حول مجال العلاج الخلوي ضمور العضلات.
And this is a video of a child from America, California, who when he came to us could only crawl. He could not even sit properly or stand. And let us see after stem cells what are the improvements.
وهذا طفل من أمريكا جاء لعندنا كان يحبي ولم يستطيع المشي، وبعد أخذ الخلايا الجذعية نرى ماذا حدث له.
So before he could hardly crawl, and now after stem cell he is able to stand.
والآن بعد أخذ الخلايا الجذعية صار أن يقف على قدميه.
And he started walking with a walker.
وأيضا يمشي بمساعدة الووكر.
Then he started walking with little support without a walker.
والآن بعد المشي
And now then he started walking indoors without any help. And now he can walk outdoors without help.
وبعد ذلك المشي لوحده من غير أي مساعدة أي أحد.
In fact, he improved so much that he was invited to the White House to meet President Obama. Then in intellectual disability, also there are good improvements. So you can see that 84% of the people intellectual disability, 84% showed improvements.
هناك أيضا الإعاقات الذهنية.
And this is a scan before which is showing brain damage, and you can see afterwards the brain damage is gone.
ممكن تشوف الصورة الأشياء المعاقة.
And again, the world's first scientific paper on stem cells in intellectual disability. This has been published by us. Then in spinal cord injury, there are some people who have a road traffic accident or they fall from height, they fracture their spine, and because of that, they cannot use their legs.
أيضا عندنا المعاقين بالعمود الفقري المصابين.
And these are our results. As you can see, that 96% of the patients improved, 24 significant improvement, 56 moderate, 15 mild, 3% show no improvement.
وعندك النتائج هذه موجودة أمامك.
And again, all our work is published in these scientific journals. We have 9 papers.
وهذه المقالات كلها نشرناها
And
من
here we will show you a video. This is a soldier from the Indian Army who was shot by a bullet, and he was totally paralyzed. When he came to us, he was totally bedridden, could not sit or stand also.
وعندنا الشخص المريض هذا مصاب بالرصاص لا يستطيع المشي. نشاهدوا معنا الفيديو.
You can see before he could, and afterwards you can see the improvement, how he's able to get up on his own. He can transfer from a wheelchair to a car by himself without any help.
ممكن تشاهد الفرق بعد أخذ الخلايا الجذعية أنه يجلس في السيارة من غير أي مساعدة أي حد.
And you saw that he was now walking. He was walking with support. He won a high gallantry medal, and he also won a shooting championship. And he has joined back duty in the Indian Army after stem cells. Then brain stroke, in which there is a brain attack in which one half of the body gets paralyzed. And here we have 50% of the patients show good improvement, 29 moderate, 11 mild, 3% don't improve. Overall, 90% patients improve.
أيضا عندنا هنا البيانات تظهر لنا للشلل الدماغي للأمراض.
And this is a scan. You can see before, you can see the amount of damage, the blue, and after stem cell, the damage is much less.
وهذه عندك الأشعة أمامك.
And again, all our work in stem cells and stroke is published in scientific journals. This is a video of a lady she was a teacher. She had a stroke, which one half of her body was paralyzed, and we'll see the improvement she had after stem cells.
عندنا المريضة هذه الذي مصابة بالشلل وبعد أخذ الخلايا الجذعية كيف صار التطور لها.
So you can see that after the stem cell, she's able to walk herself. And most important, she joined back her job. She was a teacher, and despite a brain stroke and paralysis, she improved so much that she's now joined back her teaching job.
هي مدرسة وهي رجعت للمدرسة ثانية للتدريس.
Then in head injury, people when they have a road traffic accident after which they have a head injury, here also we have very good results. And here you can see the brain damage before, and on the right side you can see that the brain damage is gone.
عندنا برضو في الشاشة التحسنات الموضوعية بالأزرق التالفة وبالشاشة الثانية التحسن. هذا كله بعد أخذ الخلايا الجذعية.
And again, our work is published in scientific journals. And this is the last. There's a disease called motor neuron disease, in which 90% of the people die by the time they are die within 5 years. And this is a comparison. The patients who got stem cells, they stabilized. The patients who did not get stem cells, they deteriorated.
عندنا الفرق ما بين الأمراض الذين أخذون الخلايا الجذعية والأمراض الذين لم يأخذون الخلايا الجذعية.
And our work is again published in a very prestigious journal, the American Journal of Stem Cells.
تم نشر المقالات كلها.
Then a question which all of you must be, how safe is stem cell therapy? Are there any complications? And the answer is there are no major complications or adverse events or side effects. And no patient of ours, we have treated 10,000 patients, no patient has had a major neurological deterioration. But there are some minor side effects. 3% of the patients who already have epilepsy, they can get epilepsy afterwards. And 10% of the patients get a headache for 1 or 2 days.
كل هذا يتم سؤاله بعض المضاعفات. لا يوجد مضاعفات خطيرة، بل هي مضاعفات صغيرة ممكن الذي تحدث للمريض، مثل الصداع والطرش، حاجات من هذه.
So basically, stem cell therapy is a very safe treatment. There are no major adverse events. There are a few minor side effects which can happen, but they are all treatable. So it is nothing to worry.
هناك فقط أعراض جانبية بسيطة ممكن التغلب عليها. لا يوجد أعراض جانبية خطيرة بعد أخذ الخلايا الجذعية.
This is the hospital where we do the stem cell therapy. It's called the Neurosurgeon Brain and Spine Institute.
وهذا هو المبنى الذي يتم فيه زرع الخلايا الجذعية.
We have treated at this hospital more than 10,000 patients from 70 different countries, from all the 6 continents of the planet.
لقد تم علاج أكثر من 10,000 مريضا من 70 دول مختلفة في العالم.
This is our core team. Apart from myself, Dr. Nandri and Dr. Prerna are the stem cell experts. Dr. Jacob is India's senior most physiotherapist and rehabilitation. And Dr. Himangi Sane is our medical physician.
هذا فريق نيروجين الذي يعمل مع بعض.
We believe in quality control, so we have a lot of quality certifications like good laboratory practice, good manufacturing practice, and ISO.
عندنا الاعتماد الأكاديمي.
This is a picture of our stem cell laboratory, which has got very high class, one of the best equipment possible.
هذا معمل الخلايا الجذعية.
We have been certified by the European Medical Association for best medical practice. We get this certification when our standards meet European standards.
وعندنا الاعتمادات الشهادة من الخارج إلى أننا نعمل أحسن شيء.
We have published a total of 18 books from Neurogen.
عندنا 18 كتابا ينشر.
And we have received several awards like this Rose of Paracelsus Award from Oxford.
واستلمنا عدة أوارد في.
We also received the European Award for Best Practices from the European Society of Quality Research.
واستلمنا الجائزة اليوروبية.
And we received this award by British Parliament for research work that we did.
استلمنا الجائزة من لندن UK بريطانيا.
We got the Best Stem Cell Therapy Center in India Award in 2016 and 2018.
استلمنا أحسن جائزة استلمناها في الخلايا الجذعية في الهند.
To help you make a decision, there are different ways in which you can communicate with us. You could go to our website, you could email, WhatsApp, call us, or have a Skype interview with us.
ممكن مساعدتك في اتخاذ القرارات. ممكن تذهب لموقعنا، ممكن تعمل لنا البريد الإلكتروني، ممكن تعمل لنا الواتساب الرقم، ممكن نعمل معك الانترفيو عن خلال السكايب.
Once you have decided to take the treatment, we appoint a specific coordinator who will become your one point of contact for everything and will assist you for the entire process till you come to Neurogen.
بمجرد أن تأخذ القرار لأخذ الخلايا الجذعية، نعين لك فريق من المستشفى يعاونك.
And during our stay, it's a 1 week stay with us. You have to arrive on a Sunday. On Monday, all the evaluations are done. On Tuesday, we give the stem cell therapy. And Wednesday to Saturday, we have all the rehabilitation and other treatments. On Saturday, we discharge you.
ماذا يحدث أثناء إقامتك؟ توصل عندنا في المستشفى يوم الأحد، يوم الاثنين يوم الاثنين التقديمات والاختبارات، يوم الثلاثاء العلاج بالخلايا الجذعية، الأربعاء السبت يحصل التهجيل، ويوم السبت ترجع إلى بلادك.
Now, how safe and easy is it to travel to India for stem cell treatment during these times? We have a video of a patient who is talking about their experience of travel from Zambia.
My full name is Lauren. I'm from the Banda. I use Banda because I'm married. I am from Kitwe, Zambia. Zambia is a country in Africa, Central Africa. That's where I am coming from. I came on the 27th of November from Lusaka, Zambia, via Dar es Salaam in Tanzania to Mumbai, which is in India. I brought my son to the Neurogen Institute, Brain and Spine Institute in Maharashtra. From Zambia to India, I traveled safely. All that is required, should I say, for a person around this time of the COVID travel is to have the COVID certificates, which I did. We managed to get them on time to travel. So traveling from Zambia to Dar es Salaam was all right. They did not ask a lot of issues other than the exemption certificate from the Neurogen Center. That's the very most important document. That one has got to have in order to travel. Otherwise, they don't allow anyone on the plane. So once they saw that one from Lusaka, Zambia, they asked the same. Even in Mumbai, when I arrived, it was the same document. The Neurogen team have been very, very excellent in as far as giving documentation is concerned. They are efficient. They produce the information right on time. They never delayed. In my preparation, I had them on time. The Neurogen Institute, the Neurogen Center, is very, very accommodating staff. In my country, they are just giving visas for medical travel. It doesn't matter where you're going, but it has to be a medical visa. That medical visa is issued to the person who is traveling, who is sick, as well as the attendant or attendants. So the airports are not congested as before. The airports are just okay, but still there are a lot of people traveling.
So what is special about Neurogen is that we have the largest number of scientific papers. When international book editors put chapters, they ask us to write. And what is special about us is we do only neurological cases. So we do stem cell for neurology only.
ما هو الخاص لدينا أن نعطي الخلايا الجذعية للمخ والعمود الفقري فقط.
Also, we inject the stem cells intrathecally, so it directly goes to the brain. We combine it with comprehensive rehab. And like I told, we have treated 10,000 patients from 70 countries over the last 10 years.
نحن نستخدم فقط الخلايا الجذعية الذاتية الآمنة فقط، ونحلقها داخل القراب والتي تصل مباشرة إلى الدماغ المصاب. نحن نجمع بين الخلايا الجذعية وإعادة التهيئل الشامل.
And we have very experienced professionals and doctors. We are constantly researching, and all our work is approved and monitored by government certified institutional ethics committee.
لدينا فريق من المهنيين من المستوى الراقي وذو خبرة العديدة في التخصصات. نحن نبحث باستمرار عن أسباب وطبيعة الضرر العصبي بالإضافة إلى حلول العلاج الأحدث والأفضل.
So my conclusion is that adult stem cell therapy is a safe and effective treatment option for autism, cerebral palsy, and many other pediatric and adult neurological conditions which cause paralysis, for which presently there are no other definite treatment options.
من اعتبار أن العلاج بالخلايا الجذعية للبالغين خيارا علاجيا آمنا وفعالا للمرضى التوحد المصابين بالتوحد والشلل الدماغي والعديد من الحالات العصبية الأخرى للأطفال والبالغين التي تسبب الشلل، والتي لا توجد حاليا خيارات علاج نهائية أخرى لها.
So the future of cellular therapy is something called anti-aging. And in this, what we do is we have a whole lot of what is called integrative therapies, where we use ozone, hyperbaric oxygen, gut hydrotherapy, cryotherapy, infrared, and intravenous vitamins. So we use all these integrative therapies along with stem cell therapy and rehabilitation.
نستخدم العلاجات الأخرى هذه التأهيل بجانب الخلايا الجذعية.
So, like I said, stem cell therapy is an idea whose time has come. And with that, I'd like to end my presentation. I am open to any questions. So anybody has any questions, feel free to ask them, please.
لقد تم إنهاء النقاش. أي حد لديه أي سؤال، أي استفسار، أنا موجود هنا للإجابة.
So, Ibrahim Al-Haslan has asked a question. Given the current COVID-19 restrictions, how soon can we get the treatment? So the answer is, you can get the treatment anytime. Our treatment is going on currently. You can get a treatment as soon as you get a visa, and you can, as soon as travel is possible, you can come. So the restriction is only on air travel. If there is air travel between your country and ours, and what we do know is that Emirates is flying. A lot of our people are coming flying via Emirates airline, and that is flying to India. Medical visas are being given to everybody. So all our Indian consulates, if you ask for a medical visa, you don't get tourist visa, but you get a medical visa. And our team will help you and support you in getting the visa. And the visa is only for 10 days. So you can come anytime. And 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 you can come anytime. So you can get the treatment next week if you want, so long as you get a visa and travel. Ibrahim Al Shalan again asks another question: how young can you start the treatment on children? So there is no age limit, there is a weight limit. So the child has to be more than 8 kilograms body weight. So more than 8 kilograms is, about a year or so. So we have the youngest we have treated is 8 months. So we can start the treatment anytime about 1 year onwards. So uh, there is no limit like that. And the earlier we treat the children, the better it is. Uh, Ibrahim also asks, how likely is it that we would need another stem cell intervention? Well, that would depend on the severity. So, in other words, if it's a very severe case, the damage is more, then you may need a second treatment after 6 months or a year or so. But if the damage is mild, then in one treatment it gets okay. Then Ibrahim again asks, what kind of medications is the patient required to take after the treatment? And whether it's liquid or tablets. So there is not much medications. There are only some vitamins and some supplements. So actually, there are no major medications that have to be taken later. Just some very simple supplements and vitamins. Then Hani says, if a child has cavernomas in the brain, can stem cells help him? No. Children with cavernomas in the brain, stem cell not only does not help, it can actually make things worse. It can cause bleeding. So stem cells are not to be used for cavernomas in the brain. Dr. Nazneen Gazdar asks, what if after stem cell therapy it shows good result, then again the therapy can be given or some other treatment can be given? Yes, stem cell therapy does show very good results, and you can repeat stem cells again. You can also give any other treatment. So the beauty of stem cells is it doesn't come in the way of any other treatment. We can give any other treatment that we require. Then Anlene Thaisi asks, who can receive stem cell therapy and what are the requirements such as age and weight? So stem cell therapy can be received by all children who have autism, cerebral palsy, intellectual disability or mental retardation, in adults, people who have a stroke, who have paralysis, who have injury, head injury, spine injury, it can be taken by all of them. And there is no age requirement. I already answered that question. The weight has to be more than 8 kilograms. 8 kilograms is a very young thing. So there is no age limitation. The youngest child I've treated is 8 months. The oldest person I've treated is 82 years. So we can treat anybody from 8 months to 82 years. So if you may answer my question, if the child with cavernomas, Haneen had asked, so I'm repeating the answer. A child with cavernomas cannot be treated with stem cells. Not only should not be treated, it can actually make things worse. It can cause a hemorrhage. So stem cell is not useful for cavernomas. Anlene Thaisi is asking, how many times do you need stem cell for muscular dystrophy? Again, all this depends. It's individual to individual. Broadly speaking, in a mild case, you have to do it once. In a moderate case, you may have to do it twice. In a severe case, you may have to do it 3 times. So all this depends on the severity of the problem. I can't answer the question by Mohali. Can you translate it for me, please? Rega, can you translate? Can you see this question there?
There is a
The Mohali Hamisi's question. Can you translate for me?
बोलूं मैं? Sir? Hello?
Hello, can you translate that question? The question by Mohali Hamisi. It's in Arabic, so I can't read it.
सर एक मदर है, उनका चाइल्ड को ऑटिज्म हुआ है, 9 इयर्स का है. वो सुबह से शाम तक रोते ही रहता है. ये more than 3 months उसको ऐसा हो रहा है, ये रोते जा रहा है और उनके पेरेंट्स को बहुत मींस डिस्टर्ब हो रहा है कि वो रो रहा है, लगातार रो रहा है विदाउट एनी रीजन। तो उसकी मम्मी पूछ रहे कि क्या सोल्यूशन क्या है मींस।
हाँ, तो उनको बोलिए कि हमारे पास इसका इलाज है।
जी।
हमने ऐसे बहुत सारे पेशेंट का इलाज किया है और जब हम इनको स्टेम सेल देते हैं और रिहैबिलिटेशन देते हैं तो इसमें इम्प्रूवमेंट आता है, उसका रोना बंद हो जाएगा। हाँ, और उसके बिहेवियर में और बाकी सब प्रॉब्लम में भी उसको अच्छा इम्प्रूवमेंट आएगा।
जी, ओके सर।
कैन यू ट्रांसलेट इट फॉर देम?
ट्रांसलेट करूँ मैं?
हाँ, ट्रांसलेट करो, उनको समझा दो।
اوكي. مدام يقول الدكتور ان عندنا حالات زي هذه جت عندنا للطفل هذا الذي يبكي بعد أخذ الخلايا الجذعية. بعد أخذه الخلايا الجذعية يتم التحسن والتطور في الطفل هذا عن طريق التأهيل والممارسات والرياضات، يتحسن تصرفاته. فإن شاء الله بعد ما يأخذ الخلايا الجذعية، العلاج الخلايا الجذعية، حتشوف الفرق بين سابقا كيف كان الطفل وبعد أخذ الخلايا الجذعية.
Okay. If there are any other questions, feel free to ask. I also would like to announce to everybody that all those people who attended the seminar, they are entitled to a personal one-on-one medical discussion with me. Our coordinator will set up the time. So if you want, you can have a 1:1 discussion with me, which is available at no cost at all. It is completely free. So please take advantage of that, and you can have a personal discussion about your child or about yourself.
ممكن أخذ أي موعد، أي مقابلة مع الدكتور، وهذا مجانيا. ممكن تستخدم الفرصة لأي استفسار، ممكن تتصل بالفريق المستشفى يعاونوك في أخذ الموعد، وأي استفسار لديك تراجع مع الدكتور.
All right. I now request Angeline Thaisi, who is the founder and chairperson of Stem Cell Africa, to please say a few words. Angeline, can you please speak and please give gaps in between so that we can have a translation. So we'll just introduce Angeline, please. Angeline is chairperson of Stem Cell Africa, who organized this webinar.
I just want to say good afternoon to all the parents and thank you for being here, also to the families and professionals.
الدكتورة أنلي تشكر الجميع، تشكر الوالدين الجميع وكلهم الذي حضروا في السيمينار.
Further, I just want to say that as a parent, I don't think any professional or anyone will know what we are going through until you've walked in our shoes. And I'm very passionate about autism and children with special needs.
نحن نقدر الوالدين الذين يشعرون بالأطفال الذين عندهم التوحد، وإن شاء الله نقوم بعلاج التوحد للأطفال.
I just want to tell the parents that I had a school in South Africa with about 20 children and about 7 of those went for stem cell therapy who did very, very well. You always have to do your therapies after stem cell. Hello?
Rilika, please translate.
Yes.
Okay, what I have said is I'm very passionate about stem cell therapy because I had a school in Cape Town with about 20 children and a couple of those kids went for stem cell therapy and improved a lot.
لقد تم علاج 20 طفلا بالخلايا الجذعية بخلال الخلايا الجذعية.
My own son has got autism, epilepsy, and he's also blind. So I've been living with a child with autism and multiple disabilities, and he's now 36 years old. So I can relate to parents.
لقد أشعر بهؤلاء الوالدين الذين يعانون من أطفالهم بالتوحد. أنا كمان عندي طفل مصاب بالتوحد وبالأعمى وأنا عايشة معه الآن.
So once again, I just want to say if parents would like to contact me, they're more than welcome. My telephone number is +27 73 0442 116. You can ask as many questions as you want, or you can just speak to me about your child. I'm a parent that understands. Sometimes we just need to speak to someone else when you had a bad day.
أنا أرحب بكل الوالدين الذين يريدون أي استفسار أي سؤال لأطفالهم، وأنا موجودة هنا والرقم الموجود في أي وقت. أنا نرحب بكم لأي استفسار.
And thank you very much once again. And then there's a parent that's going to speak to you now, Kate, which child I think is about 6 years old, who just had stem cell therapy a year or so ago and who has improved a lot. So thank you very much to all the parents. Thank you that you care, and thank you that you have attended today.
شكرا جزيلا لكل الآباء والأمهات الذين شاركونا بالسمينار هذا، وأشكركم جميعا من داخل قلبي. لأي استفسار وأي شيء أنا موجودة هنا.
Okay, Dr. Alok, can we get Kate to speak? Thank you very much.
شكرا جزيلا.
I think
Hello?
we permitted her. Kate, go ahead, speak.
Yes, my name is Kate. I'm a mother of a child with autism and he's 6 years old.
أنا اسمي كيت وأنا أم لطفل عمره 6 سنوات.
As I said, he has autism and he was diagnosed when he was 3 years old.
وطفلي مصاب بالتوحد، وعرفت هذا لما كان عنده 3 سنوات.
Just like any other parent, we've struggled a lot with different supplements, with different treatments, different protocols, until we came across stem cell therapy.
زي كل الآباء والأمهات لقد عانينا الكثير بسبب مرض ابننا الذي مصاب بالتوحد. لقد ذهبنا هنا وهناك وأخيرا وجدنا العلاج بالخلايا الجذعية.
And when we organized ourselves, we traveled to India, to Neurogen, met with Dr. Alok and his team, where we started our son's treatment protocol.
وبعد ذلك بعد ما عرفنا الخلايا الجذعية الموجودة فقط في الهند، لقد تحدثنا مع الدكتور ألوك شرما وأجينا من بلدنا إلى الهند لمعالجة طفلنا بالخلايا الجذعية.
As a parent, I had so many challenges with my son. Like he could not sleep, he did not have eye contact, he could not even accept to be brushed his teeth. But at the first stem cell, he's able now. He immediately after the treatment, he started accepting some of these things we were asking, like to brush teeth and learning how to use the toilet.
لقد عانينا الكثير من طفلنا هذا. سابقا كان عنيد ولا يسمع الكلام. بعد أخذ الخلايا الجذعية لقد ظهر التحسن لديه، أنه يقوم يأخذ فرشة الأسنان ويقوم بعمله.
I can say we've seen so many improvements Like now when you call him, he can respond. And he has improved. He had low muscle tone, and right now he's so much far better. He's doing very well that he can even ride bicycle. He can swim. He can do puzzles, and his speech is coming slowly. We are actually preparing to travel for our second stem cell shot next month.
لقد شاهدنا العديد من التطورات في طفلنا. إنه يبدأ أن يقرأ ويبدأ أن يكتب بعد أخذ الخلايا الجذعية.
As a parent, we are very happy with the progress, and we look forward to do another stem cell. We hope in the near future I will be out of this condition and become more independent.
كوالدين نحن مبسوطين ومرتاحين للعلاج بالخلايا الجذعية لطفلنا الذي حصل عليه، ونتمنى مستقبلا أن نزور الهند ونعمل المرحلة الثانية.
For me, Dr. Alok, I'm so grateful. Me and my husband, my family, we are super grateful for all that you've done, and the doctors at Neurogen for the support you are always giving us on our son. And Madame Andeline, we are very, very grateful.
نشكر جزيلا من أعماق قلبنا الدكتور ألوك شرما وفريق فريق الدكتور مستشفى النيروجين لمساعدتهم وخدمتهم لدينا.
Okay, for me that's all. For any parent who would wish to know more about stem cell, you can always call me. You can always chat me. My number is on the flyer which I was sharing out. I've become an advocate. I've become like I want to create awareness of this recent treatment, because I know very many people out there, they don't know that there's something which can help their children. So you can always reach out to me anytime.
ممكن اتصالك بي في أي وقت لاستفسار أي شيء عن طفلك. ممكن أساعدكم بإعطاء استفساراتكم، الرد على سؤالكم. شكرا جزيلا لكم.
Thank you everyone. Thank you very much.
All right, I thank you everybody, and since there are no more questions, we will end the meeting. And once again, just to inform you, anybody who wants to have a discussion with us 1:1, you're welcome to do that. And with this, I wish you all a good evening and a good night. Thank you.
في نهاية النقاش أتمنى لكم أن في أي وقت إذا تريدون أي استفسار نحن موجودين هنا لرد على استفساراتكم، ومع السلامة في أمان الله.
Thank you. Shukran.
شكرا جزيلا.